So, intensive care units filling up across the country, and we have learned about the desperate modeling and looking at resources, number of beds, capacity, and critical equipment. This morning, every hour, we're going to introduce you to people who are answering the call. We've learned in this country that there is a shortage of PPE, things like masks and shields and gloves and gowns and critically ventilators. And we've heard calls from public health officials and from government leaders to have companies and industry step up. And hour by hour this morning, we are going to introduce you to companies and individuals who have done just that. Because as I mentioned, we're focusing on the good on this Good Friday. So let me introduce you to Dr. Joe Fisher, who is with me this morning, renowned in his research science realm. He's a professor of medicine and anesthesiologist in Toronto, and part of a team at Thornhill Medical that has done something rather extraordinary in response to the pandemic. He is with me this morning, live. Good morning, Dr. Fisher. Thank you for being our guest.
Good morning. Thank you very much for having me.
I am going to call up the pictures that you have shown or sent to us so we can take a look at what your company makes. Now, I would say that's maybe a ventilator, but you would say that's the wrong term for this. Tell me about what it is that you make.
So what we make is actually a life support system. It includes a ventilator. There is a ventilator in there. You can see the tubing that comes from the ventilator. But it does more than just ventilate the patient. It's a complete life support system like you would have in an intensive care unit.
So, okay, so the tubes that are at the front, that's the ventilator component, but it's much, much more than that. And this you've been making for some time. And as I understand it, Dr. Fisher, this is normally something that has military use?
Yes, it started off, it was actually commissioned by the American military. I started off as a scientist. I had a small lab where we were looking at the efficiencies of breathing and oxygenating the blood. And I came to the attention somehow of the United States Marine Corps that was looking for a way to get rid of oxygen tanks in the battlefield. And they thought that the efficiencies that we have would allow them to have a small, portable oxygen delivery system that wouldn't need an oxygen tank.
And hence your invention, and hence what we've just been looking at. And so we'll keep looking at that, because it is so interesting. How many of those have you made traditionally?
Well, we make them to order. So there are militaries around the world that order them. Mm-hmm. It basically, as I said, is an intensive care unit. It's not just a ventilator. So the militaries find themselves and their patients in the middle of nowhere often, and they require a lot of care because they're very injured and multi-organ injuries. So they need all the care that they can garner in that field. So it's not just the ventilator.
No.
The rest of it.
Sorry, I wasn't clear. In terms of numbers, it's about 50 a month, as I understand it, that you would traditionally make, correct?
We could make about 50 a month,
okay.
Depending on the number of orders that we have.
All right. So now in these times, you are stepping up to manufacture your ventilators for the broader use during this pandemic. And how are you adapting in your business, and how are the numbers changing?
Yeah, so again, these are life support systems. So they're not just, the ventilator is just one component of it. Yes, we've adapted by partnering up with Linamar, another Canadian company out of Guelph that has a large industrial capacity. And we teach them, they teach us, and we can ramp that up to whatever is required.
And how many do you project, from 50 a month to what, potentially?
Potentially about 400 or 500 a month.
So 10 times. So what are the challenges of ramping up production to that degree?
The main challenge we've already met, getting the people, getting the space, having the tools and so on. Now we just need the parts for to be able to put everything together. As you can imagine, there are hundreds and hundreds of different components and parts in these devices, and we need to acquire those.
And when do you see production at full strength and these actually heading out the door to hospitals that will need them?
All I can tell you at this point is as soon as possible. You know, you're sort of talking to the science and medicine guy, not the production. There are whole teams of production people that are putting this together. I think they'd be better telling you.
You are the science brain, not the production and supply brawn. I've got it. All right, but ASAP.
I'm the science doctor, medical guy.
Let me ask you, as we watch the system, the life support system, as we're looking at it there beside you, just really an impressive looking device. One of the things that we've learned, Dr. Fisher, in the past couple of days, and I think it's been a real revelation to Canadians, is how short of critical medical supplies Canada is, PPE and also ventilators and systems like yours, more advanced than the ventilators, but the shortage of ventilators in general. And many people have talked about this is a wake-up call that Canada needs to be more self-reliant, that more of these supplies need to be made in this country. I'm wondering if perhaps you could have told people that. If that has surprised you, or whether you think this is going to bring about some change.
Well, I hope it brings about some change. You know, I have to say we were surprised because for the longest time, we were very globalized and things didn't matter that much where they came from. But from my point of view, you can see that we're sitting with something that is as useful as that. I'm not sure we got enough attention from Canadians that we are a Canadian company. We're right here in the middle of Toronto, and we're producing things that are, I don't think there's anything like this anywhere in the world.
Well, we have learned, Canadians are learning the lesson now, hopefully not too late, as companies like yours jump in and try to help up and make up for the shortfall. Dr. Fisher, thanks for getting up early for us this morning. It's been a pleasure to meet you and to talk about your system and how it's coming into play here.
Thank you very much for your interest.
Thank you.
Thank you.